A big hello to all our viewers on this live broadcast session by Voice of Healthcare. This is Dr. Naveen Nishchal. I'm your host of the day. Today, we are fortunate enough to have with us Dr. Nitin Madan Kulkarni. He's a doctor by training, but he's practicing management. Yes, he's Principal Secretary, Health and Family Welfare, Jharkhand. Sir, it gives me a great pleasure to welcome you to this very special episode of Thought Leadership hosted by POH Network. Welcome to the show, sir.
Thank you. Good afternoon to all the viewers and good afternoon to Dr. Naveen and his colleagues out there.
So, our big goal today is to gather unique knowledge, insights, and inspiration from Dr. Kulkarni. I think nothing unites better than the power of shared experiences. And my philosophy is the more we spread our ideas, the stronger we make our community. Sir, for this session, we will be having a free-flowing chat. So let's straight dive into the conversation.
Yes, please.
Sir, very thank you. So my very first question to you is about vaccine. Vaccine is a buzzword these days. While all frontline workers, healthcare professionals are being vaccinated across the nation. So I was curious to know what's the current status in Jharkhand in terms of vaccination of these frontline workers, how many centers we have in the state, and how many healthcare workers are to be vaccinated. And lastly, do we have enough vaccines available for these frontline workers?
Well, I think the D-Day is already over on 16th when the vaccination has been launched by Honorable Prime Minister, and in our state also it was launched by Honorable Chief Minister and Honorable Minister of Health. And we had already vaccinated about 3,200 our healthcare workers on 16th itself. The Government of India has finalized the number of centers depending on the vaccine supply chain, and accordingly Jharkhand has been allotted 48 centers. So we are supposed to vaccinate 100 people in one day, and accordingly through COVID software this entire vaccination is being monitored and controlled, in fact. So we are continuously generating the sessions, and yesterday's break of Sunday was quite helpful. Today vaccination is going on in full swing in all the 48 sessions. So we have got 2 sessions each in all the 24 districts. So that makes it a target of, you can say, 4,800 per day. Obviously, it is being given to all the healthcare workers in the first go. They come from private as well as the government sector. And we have enrolled about 140,000 of them on the COVID software right now. So we have to vaccinate these many people before we get to the next plot of the frontline workers. So we are continuously working on it, and it is being monitored at all the possible levels. Our cold chain systems are in place, and till now, as we are talking, we have got almost now second day is also getting over, and we have got a very minor, what you can say, adverse effects in the form of just some dizziness and some headache. Nothing to be concerned about till now. So that's a good news for us that at least no adverse effect has come up as far as this vaccination drive is concerned. So we are continuously monitoring it, and in fact we are more concerned about it. We have made adequate arrangements to monitor the adverse events at all the hospitals with a team, special team to monitor and take care of the situation. And we are hopeful that it will not be required to be used, but it will always be present.
Got it. So it's a great news indeed. And, there are various type of vaccines available in the world, and a lot of companies are coming up with good vaccines according to them, like Pfizer, Moderna. And in India, we have 2 indigenous vaccines available. One is by Serum Institute of India, and another is by Bharat Biotech and ICMR. So do you think, how people are reacting to these to different type of vaccines? I mean, are they skeptic to one or the other vaccine? And what are your views as a doctor to these two vaccines?
See, as far as my state is concerned, here we have got only Covishield vaccine. So we are not having that dilemma of which vaccine to use. And
Okay.
about Covishield vaccine, there was some hesitancy in very few places, but more or less it was acceptable. As I gather from the newspaper reports and from my colleagues in other states, we find that there are some reservations about the other one. And I think that is cropping up mainly because people are required to sign the consent form for that. So if
Yeah.
people are required to, if you make people sign the consent form for some activity, obviously people get suspicious about it. There must be something, that's why I am
Yeah.
made to sign on it when other thing is not being signed.
True.
As far as
True.
Jharkhand is concerned, that problem has not cropped up. I hope that people will accept the other vaccine too, because since both have been cleared by the drug controller, so we have to take it that they are safe and they are equally, their efficacy and immunogenicity should not be put to question in any possible way. And we are expecting more such vaccines to be launched in a near future because as we
Yeah.
can gather from the newspapers. So I think in coming 2 or 3 months, we'll have lots of options as far as vaccination part is concerned. So
True.
once that supply chain is ensured, maybe the vaccines shall be available for in a private manner also. I think that will solve most of the problems and also address most of the concerns of the people.
True.
But right now, the only thing we can prove is that we must try to vaccinate as many people possible. And if we don't get any adverse events following immunization in this 7 or 8 days, I think people's faith will go on increasing like anything. Another thing which has been done by government of India is to utilize the leading doctors of the country. In the vaccination drive yesterday, we saw Director Ames himself being inoculated. Dr. Paul got
Yeah.
inoculated. So I think all these messages convey will definitely help all the people to increase their faith in the vaccination process, and they will definitely come forward for it.
Yeah, I fully agree with you. And one point I would like to make here from safety point of view, from safety perspective, I think Covaxin is also safe because it's a killed vaccine, and we have been, having all these killed vaccines for so long. Although this Serum India Institute vaccine is a newer technology, Moderna and Pfizer's are also newer technology, while killed vaccines are here for quite some time. So I think from safety point of view, all these vaccines are safe.
They
So
have to be,
Dr.
had they not been safe, I don't think the drug control would have given them go ahead to be used for the population.
Yeah, fully
And
agree
more
with
so,
you.
we are giving them to all our healthcare workers who are actually the people who are leading this battle.
Yeah,
So if we
yeah,
are exposing our healthcare force to these vaccines, they must be safe. So we take it in
yeah,
that way also.
yeah. It means, I mean, these vaccines are safe. I completely agree with you. So I'll go a little, back when this COVID started, when India had its first case, and I was going through the literature. Jharkhand had its first case in the month of April. So when you got to know that yes, COVID has arrived in your state, and you being uh, in charge of the health in your state, so what all steps you took as an administrator as well as a doctor? I mean, I'm sure your medical training has helped you in containing the spread of this virus. So I would love to know about this, that how did you manage this situation?
See, as we all know, after the first case was reported from Kerala, then subsequently we had few cases in Rajasthan, and suddenly then the cases started coming up. So, as far as Jharkhand is concerned, we never had any virology laboratory also here to start
Yeah,
with. So our samples for first 1 week they went to Kolkata lab or the Pune lab. And from 14th March, I still remember from 14th March, we started testing at our own lab. We made one lab functional and our samples started testing there. And every day in the evening with bated breath, we used to wait to get the news about the first positive of the state. So we had a long wait because the first positive finally came on 31st of March,
Okay.
and it was a Malaysian lady who had come in that Tablighi Jamaat tribe, and when they were checked, she was found to be positive. And after that, suddenly the state's thinking, the people's perceptions, everything changed, because by that time people were sort of in a mode ki it seems Jharkhand is bit aloof of this and all. But once those things came, before that, our first task was to improve our testing capacities. So
Yeah.
we went, as I told you, that we did not have any single testing lab, but within 3 months we set up 7 RT-PCR labs with BSL-2 standards, and each lab has a capacity of 1,000 plus per day. So though that testing capacity improved, and then we understood that setting up a RT-PCR lab required some more time. So we found that TrueNAT machines are the easy way to get it tested, and it also gives a quick test results and more authentic also.
Yeah.
So we
Absolutely.
changed our strategy, and we within 2 months of time we purchased about 300 odd TrueNAT machines, and we put them in all our district hospitals as well as in some of our sub-district levels. So the testing facilities was available in all the 24 districts, and at many of the sub-district levels also. Our only concern was training the manpower and creating the, because see, the laboratory technicians and the people, other people never had any experience of such things. So we had to train them, number one. Number two, assure them about their own safety. That was, I think, the major concern, to make them assure that you are safe. We are providing you all the protective equipments, etc. Still, we had lots of healthcare workers who turned positive. On other hand, we also had to arrange for the clinical management of the cases. See, Jharkhand health systems are obviously deprived in the terms
Yeah.
of manpower as well as the equipments. But I am very
Infrastructure
happy
as
to
well.
tell you that, yeah, infrastructure part of it. But I am very happy to tell you that this pandemic, something good always emerges from such things. And now all the 24 districts are having at least a 10-bedded ICU and at least 50 ventilators. And more important, our staff has been trained to handle them. Most of our staff had never even seen the ventilator, leave apart operating them. So now they are confident enough, and they are able to operate the ventilators because of continuous trainings, monitorings, and exposure. And our hospital people also they developed confidence in themselves. I think that is the most important takeaway from this, that now they became confident. It is an epidemic and it can be handled. It is nothing to be made a lot of sort of something that we don't need to touch and all. Our
Yeah.
most of the private healthcare facilities were closed, and that time only it was the government system, government facilities, and all our healthcare workers, right from the lowest village level Sahiya to the doctors, senior doctors, all were in their place. And I think that was the key when we ensured that if you compare the statistical figures of many other states, nothing to be boasted about, but if you compare the statistical figure, Jharkhand managed the situation comparatively better manner. Considering, I take it, considering our situation where we were actually. Like we
Yeah.
were not like Mumbai or Delhi situation where things are in place. We had
Yeah.
nothing in place actually, but setting up
Yeah.
all the things, and that was an experience in itself. I think people have learned a lot from it. We have also learned a lot from it. As far as my being from a medical background goes, see, these are all administrative works, so one does it as an administrator. But when some person who knows the thing actually is handling it, so you don't have to explain the things again and again.
Yeah.
One knows what is that, what does BTM kit means, what PPT means. So you don't have to explain that this is what is BTM kit, this is what is RT-PCR test, this is what is true that. So you know, so it becomes a lot easier. And another thing, convincing the higher policy makers, particularly the political leadership. I think that was the one of the important aspect of it. Being a officer plus a doctor, I think when I say something, it carries more to convince them about decisions. So, all this is particularly the testing issues, like how testing, what type of maximum people get tested, as well as the resources are also properly utilized. I think that we could do to a large extent. So, and rest is obviously God's grace that we could do it. We had a lot of problem in the month of June, July, when lots of migrant labor started coming back from the various states. So I think we had about 8 lakhs of them who came and dispersed in various villages. So we had a house-to-house survey conducted 3 times during this pandemic through our
Wow.
rural health workers, and they went each house, found out who were having likely to have symptoms, who was having symptoms, isolated the people who had come from Mumbai and Delhi and some high risk areas. And I think all these factors finally counted somewhere that our caseload dropped drastically. And last 2 3 months, in fact, now it is not even a sort of people are not even taking it as a concern. So that way, it has been a great learning experience. I don't think in a lifetime of an officer or a doctor you will get to get such exposure in a time. So it was a good learning for me also.
Yeah, I fully agree that this pandemic has stretched our capabilities, and there are a lot of things we didn't know that we can manage, but we have been able to, manage things very well. So
Certainly, certainly.
while you rightly said that we can't compare Jharkhand with Delhi, Mumbai, and while it comes to secondary care or tertiary care, quaternary care facilities are concerned, these are concentrated in metro cities, bigger cities. And when it comes to state like Jharkhand, so we don't have even secondary care or some in some cases tertiary care facilities available in a lot of district towns of the state. And you would agree that healthcare has been always in the back burner for government, and this is the first time because of COVID, healthcare is in the limelight. While you are addressing a lot of challenges related to COVID, so what are other healthcare challenges in the state of Jharkhand, and what all steps you have been taking to manage all those challenges?
See, while COVID went on, one of the major issues was to ensure the other services remain functional. Because I told that most of the private facilities were off offline. And then suddenly we discovered that dialysis center owner are not able to get the dialysis services. So that ensured that our dialysis center or all these hospitals remain functional very quickly. Otherwise, it would take some time maybe. So another important challenge which we face that most of the states is that they immediately compare any existing facilities function. Now, even so situation of our areas. And also we are not having enough specialists to address the disease. We do not go into uh, issue here. We found that doctors actually dealing with the patient. So that is also issue. Obviously, major issue for any state for that matter is investment in the health sector. While we say that each state should invest about 5% of the GSDP, center should invest about 6%, 5%, but actually in Jharkhand, if we say it is hardly about 2% of the GSDP. So we need to increase the investment in the healthcare, and investment not only in the form of creating the infrastructure part of it, but creating a manpower part of it. Healthcare is a function of a manpower. Even if you don't have a building, you can still manage it but without manpower, you cannot work. So we require some quality manpower. Medical research is another important challenge for us. We have very less type of medical research in this part of the country. Most of the papers are very routine types of papers, not much research concerning the local tribal population, the diseases and the health problem faced by the tribals. All such things require a lot of research. That is one important issue. Then, obviously, in ensuring the consumables and procuring the equipment, servicing the equipment in time. Many We don't have many suppliers or service providers who are ready to open their offices in this part. So the person has to come either from Kolkata or from some other place. Obviously, it takes its own time. But we don't even have a robust health record system where a person can carry his digital record from one place to another, and he need not be actually present. Then lack of penetration of health insurance, so it increases the out of pocket expenditure for the poor. So all the challenges being written, and we need to really think through and work on it. But the basic function remains that if you have a proper trained manpower at all the levels, be it a doctor and paramedicals, most important. Like pandemic also, we have seen most of the work was done by the paramedicals,
True.
whether it was collecting the samples, testing the samples. But so the good quality paramedical workers and good medical research, these things I think are the really key things which we need to work upon, and we are already working on improving the manpower quality, because unless you have a good human resource, it is very difficult to
Yeah.
deliver, particularly in the times of the pandemics.
I fully agree with you that I know as a state you are going through a lot of challenges, and healthcare resource remains the an important part of our healthcare ecosystem, and skills development is something really required in your state. And I'm sure with yourself sitting on the in driving seat, I'm sure you will be able to curb all these challenges. I will ask you something, something from your personal life. I mean, although you are living a public life, but behind the curtain, you are always a person with family and a lot of hobbies and interests. So, what did you tick last in your bucket list, and what's the next?
Okay. Uh, I think first we should stick to it, because right now, for last at least 6 7 months, there is hardly
Yeah,
any personal life left, except for being in home. Otherwise, most of the time, because when entire all the government was almost closed for 3 4 months during the lockdown, I was the only
absolutely,
person who used to come and run my office, go to the hospitals, and I had no option. So the first
absolutely.
task as a health secretary from my bucket or basket, if you say, that I want that ensure that all the 24 district hospitals should provide the simple secondary healthcare at least. People should not be allowed to go to the medical colleges for a normal simple procedures. They should be able to get them at their district headquarters max. Ideal will be the community health center, but still I think we're really working towards it. So that is as far as my official part is concerned. As well as my personal part is concerned, now I'm very conscious about my fitness, and I take care of my daily routines. I'm very punctual about and very particular about it. Reading some new good books, writing some new articles, completing some new studies. These are the some things on the agenda, and I think I should be able to achieve most of them during this time.
Very, very noble initiative. And we at Voice of Healthcare, definitely need some of your articles, some of your, sessions. And I'm sure your team will, keep bothering you for all these
In fact, to
articles
share
and
with you,
sessions.
to share
Yeah,
with you, we designed a study about this lowest grassroots level health worker, and we are working on how to improve the meaningfulness of her work.
true.
So we have put up some interventions, and I think the study findings should be out very soon. We have already drafted the first draft of the report, and I think that will be a good method to that what interventions we need to make to ensure, see,
Yeah,
because for a grassroots level health worker to continue being motivated
true.
24/7 365 days, it's very difficult. For you and me it is very
Tough, very
easy, because after all our lives are very differently organized. But for them staying in the villages and continuously, and we expect them to continuously deliver 24/7 all the services, same thing
Yeah,
day
yeah.
in and day out. So we thought that that's a good idea. In consultation with a professor from IIM Ranchi here, we started a study, and let me see how
Okay.
far it goes. I am expecting to implement those findings so that we can actually bring some changes in their working.
So I would request you, whenever you publish that study and articles, please do share with us. We would also like to launch at a Voice of Healthcare platform. It would
Sure, sure,
be an honor indeed. Yeah.
sure, sure.
So, so we are pretty much in the end of the session. Before we go, you are a doctor practicing management and administration. What is your advice to doctors practicing medicine or other healthcare stakeholders?
See, one must be always be in a learning attitude. Most of the time we find that as soon as we get into that I have become a doctor, my job is done, I will start doing my practice, see some 50 patients, be happy. You can be happy, obviously there is nothing wrong in it, but if you have a learning attitude, I think that will take you definitely much farther, and it will give you lots of inner satisfaction. So keep a learning attitude. And number two, you must have a agility. In today's world, you cannot be a person who can stick in a place and be stuck in your thoughts. Either way, whatever way you think it, but you cannot get stuck anywhere. You have to move on. And you have to move
Yeah,
on and you have to have that agility. Most of us are now getting that into like when this pandemic started, I found that some of the doctors were of the opinion that no, what will happen, we will not do this, we will not do that, and then I had a sort of argument also with them. But finally, if you are a doctor, if you are a doctor, you have to deliver. You cannot tell the patient, look, I am scared of particular virus, so I will not touch you or I will not treat you. And patient requires a human touch. However
yeah,
telemedicine, however AI you may introduce, but finally, when the doctor holds for that pulse, I think that is the
yeah,
place where actually the cure takes place.
yeah,
That is where they always say na, that it's 50% cure takes place when the first interaction with the doctor, 50% by the medicines. So we must follow this
yeah,
principle, and as a doctor, we must keep on abreast with the latest happenings in the our sector. You cannot be immune to that and say, "Ki, no, I am okay with whatever knowledge I have." No, knowledge is increasing like anything, and you have to be prepared. You cannot just blame the technology. Tomorrow AI will take over, so you take over your job if it is so
yeah,
easy. But that human touch till you can retain in your behavior, in your conduct, in your dealing with your patients, I think that is where that is what it will determine the better of the lot. Otherwise, there are a number of doctors in the field. So just be agile, and most important, please take care of your health. And that is possible only by
so
you. Nobody else will do it for you.
yeah,
You have to do it for you. So please do something, spend some time with yourself. Earning money is
yeah,
okay, you definitely earn it, but at the end of the day, if you are not able to sleep 6 hours, 7 hours, it's not
yeah.
worth it at all.
So very good piece of advice. Learning, agility, and personal health fitness. These are indeed need of the hour for everyone, and especially healthcare fraternity. I wish we could go on with this truly engaging discussion, but unfortunately, that's all the time we have today. Thank you very much for an inspiring session today, sir. I'm grateful to you for sharing your precious time and esteemed opinions with us. We hope to have you again with us. Thank you very much, Dr. Kulkarni. Thanks a lot.
Thank you very much. It was pleasure to talk. Thank you very much.